Hello exam takers, welcome at Dr. Rami Cardio Club. Let's quiz ourselves with a super challenging case that's very likely to be in your exam. Here we go. Mr. X, 60 years old with history of diabetes, hypertension, hypercholesterolemia. He has chronic progressive fatigue over last 2 years as well as palpitation and shortness of breath on doing exercise. Fatigue as a complaint is very big in medicine. It could be due to uncontrolled diabetes, due to chronic illness, due to thyroid, due to vitamin B12 deficiency, a lot of things, or due to anemia. Let's see. On examination, his vital data are normal. Abdomen is lax, non-tender, and no organomegaly. Chest is clear to auscultation bilaterally. Harsh systolic murmur is heard over precordium and propagated to carotid artery. Harsh systolic murmur is heard over precordium and propagated to carotid artery. Don't continue. What does it mean? Yes, exactly. Aortic stenosis. Harsh systolic murmur over precordium and propagated to carotid equals aortic stenosis. His lab investigation showed hemoglobin 8 grams per deciliter. His MCV is 60, white blood count 6.5, and platelets 340. LDH, bilirubin, thyroid, kidney, liver are all within normal limits. What is the most probably cause of his complaint? Obviously, he has anemia. When you see anemia in the case, the next question is, what kind of anemia according to MCV? I would like to classify it into microcytic anemia, normocytic anemia, or macrocytic anemia, because the causes will be different. So we have here MCV is 60. This means that it is microcytic anemia because the normal MCV is between 80 to 100. So what are the most probably causes of microcytic anemia? Iron deficiency anemia. Iron deficiency anemia is the most probably cause of microcytic anemia. Alright, so the answers given to us: iron deficiency anemia, anemia of chronic disease, hemolytic anemia, colonic blood loss, bone marrow suppression. Iron deficiency anemia could be anemia of chronic disease usually causes normocytic anemia, so it can be excluded. Hemolytic anemia, normocytic anemia, not the answer. Colonic blood loss. Any blood loss can cause iron deficiency anemia on the long run, so still in the answers. Bone marrow suppression is a kind of normocytic or macrocytic. Normocytic as a type of chronic illness, or macrocytic due to presence of premature blood cells in the circulation. So it could be 1 or 4, iron deficiency anemia or colonic blood loss. What do you think? Great. The correct answer is 4, colonic blood loss. My goodness. Why? Let's see. This patient has a syndrome called Heyde syndrome. Heyde syndrome is a triad of aortic stenosis, which is an acquired coagulopathy, and the anemia. Anemia caused by bleeding from intestinal angiodysplasia. And what's interesting, the most common site of angiodysplasia is the sigmoid colon. Aortic valve stenosis with gradient 50 mm mercury or more has been linked to von Willebrand factor deficiency, which is, if you remember, it is responsible for platelet adhesions, and it is helping or acting as a cofactor for coagulation factor number 8. So von Willebrand factor deficiency will cause a kind of coagulopathy which will ease the bleeding from the angiodysplasia, which is an association with the aortic stenosis. So what is your next step to treat this patient? Would you give oral iron therapy? It is not that easy type of iron deficiency anemia. IV steroids is given to hemolytic anemia, not the answer. Von Willebrand factor infusion, maybe. Aortic valve replacement, yes, it could be. Bowel resection. What do you think, guys? The correct answer is 4. Aortic valve replacement. Let's see. Patients with Heyde syndrome who are treated by intestinal resection generally continue to bleed from other sides because this is a diffuse disease. We said that most commonly to be present in the sigmoid colon, but actually it could be in other sides. Aortic valve replacement usually cures the coagulopathy disorder and anemia, because if you have a look on a retrospective study of 91 patients with aortic stenosis and chronic unexplained gastrointestinal bleeding, this study revealed that bleeding ceased in 93% of patients after aortic valve replacement. So this is the correct answer. How about bowel resection? Bowel resection and the blood transfusion are reserved for severe life-threatening intestinal bleeding. Von Willebrand factor infusion showed no improvement of patient's condition at all. That's why the correct answer should be aortic valve replacement, which is very interesting. My beloved doctors, I wish you loved this session. I wish you the best of luck in your end over. Good luck. Bye bye.